my channel. Thank you so much for being here. If this is the first time on my channel, please consider subscribing. My name is Marian. I'm a labor and delivery nurse, and on my channel I talk about nursing. I do vlogs, a little bit of everything. So if this is something you enjoy watching, please go ahead and subscribe, okay? In today's video, I am going to talk about nurse burnout. All right, a lot of people are quitting their jobs for one or two reasons, but majority of the time it's due to nurse burnout. Okay, what is nurse burnout? Nurse burnout is just a mental, physical, emotional exhaustion when you've had it, can't do it no more, period. So a lot of times when people go through this, the ones that are experiencing it every day, for them at work is a bad day. Like, you can't make them want to be there at all. Okay, this may make them get disinterested in the job, detached, disengaged, and just a whole lot more. So what are some of the causes of nurse burnout? Some of the causes of nurse burnout includes working long hours, lack of sleep, and just working in like the high stress level areas of nursing, the areas in the ICU, ER. A lot of the nurses that work in this specialty deal with a lot of combative patients. They deal with like traumatic injuries. There's increased mortality rate, and they also have to deal with ethical dilemmas, which, you know, all of this can cause so much stress, and that can lead to burnout. Another thing is lack of support. Nursing is one of the professions where teamwork or collaboration is like very important. It's not only important to do your job, but it's important in saving lives, okay? Because sometimes when certain things happen, like when there's a code, if there's not great teamwork, lack of communication, whatever, you can cause that person's, that person to lose their life. So sometimes there's like conflict among co-workers, there's miscommunication, there's peer bullying. This happens a lot in nursing. If you're new to the profession, I just want you to understand that it's going to happen, but there are things that you can do to help you get through this, and we will talk about that towards the end of the video. Another thing is emotional strain from patient care. One of the most rewarding things about nursing is the patient care. You take care of these wonderful patients, and sometimes you get to make connection with them, their families. And if you work in certain areas like ICU or in the ER, critical care, where a lot of times you watch them go through so many challenges regarding their health, you do everything you can, and just when you feel like they're getting better, or they're recovering from whatever it is they were going through, and all of a sudden they may pass away or other things may happen, and this can cause you to go through so much stress. It's also just like in labor and delivery, when you care for patients who are experiencing IUFD. Oh my God, sometimes just helping them go through that can make you feel so emotionally drained, because even though you're not the one this is happening to, but you feel it because you're there with them. Sometimes you're there with them for hours and hours, and it takes so much from you. So another thing is the nurse to patient ratio. So there are studies that have shown that anything greater than 1:4 ratio can increase the risk of burnout, because there's just not good patient, quality of patient care when you have more than 4 patients. So you just find yourself running around the whole night trying to do tasks if you have so many patients. Danger of nurse burnout. This is a serious concern for nurses, employers, and the patient as well. So nurses have depression disorders, they quit their jobs, they go through so much emotional stress because of this issue, and also there's low patient quality of patient care. Overexhaustion can just lead to so many medical errors. If you're going to work, you're exhausted because of lack of sleep and all these other things, you're just not able to focus and do your job right, and this can cause so many issues in healthcare. It can also lead to increased mortality rate um, in the hospital, especially if you're taking care of so many patients, and you have lack of concentration or focus on what you're doing. So the good news about nurse burnout is that it's preventable. Okay, so you ask yourself, how do we prevent it? All right, so first of all, make sure that you work on your schedule. Nursing has very long hours. A lot of the shifts for nursing is 12 hours, 3 days. And some places I know, depends on, where you work, they do 8 hours. So you can, it's up to you. You can decide to do 8 hours, or even if you do 12 hours, try to spread your days. I know for some of us, we like to maybe do all 3 days, consecutive 3 days, and just knock it out and then you have several days off. So that can help you to take some time off from work, at least every other day, or whichever works for you, but try to spread your days out. Okay, and also make sure you take breaks during your shift. I know sometimes it's impossible. It depends on how your shift is going and how much work you have to do, but try to at least take a break. And also, it's very important to take vacations. Even if you don't go anywhere, you can have a staycation. Just stay home, take a drive to maybe the next city, do something relaxing, and just get away from the work environment. That can also help a lot. All right, and also seek support if you feel like this is something that's causing you problems at work. Find a buddy, find someone that you're close to at work, someone that you can talk to, a friend that you can discuss issues with, that can be that source of support for you. And you can also reach out to leadership, management, talk to your managers, talk to your charge nurse. I know sometimes it's hard because some of them you can approach, but just find that way. And if someone is bullying you, you find yourself in situations where you're going through having so much issues with co-workers, just try to pull them aside and talk to them. When I was a new nurse, I did this a lot, and I'm not the type of person that you bully. So I would just pull you aside and talk to you and let you know how whatever it is you're doing make me feel. And if that doesn't work, then I'll definitely go up the chain of command, probably talk to a manager or someone, and I'll make sure that I let you know. If you do not stop, I'll be reaching out to a manager to let them know that this is happening. Because a lot of times nurses who have been in the field for a long time think that they can just talk down on the new nurses, but they forget that they were also once down that path. So I just don't get it sometimes, but it happens a lot in our field, especially when you work with a bunch of women. Drama never ends, but you'll find ways of dealing with these as you go on. Something you can also do is find some coping methods, like if you practice deep breathing, if you listen to music, make sure you get some exercise after work. One thing I really like to do is bike riding. So that's like one of the things I enjoy doing. I also love to go swimming. So whatever it is that you can do to help you relax during your on your days off, before or after work. A lot of times, well, if you work day shift, it will probably be after work. But for night shift, sometimes we have time to do certain things before you go to work, or maybe after you come from work in the morning, do some exercises, something to help you, have a good rest. And also you can change specialty. So if, let's say, you work in ICU, in the ER, and you're just tired, you feel exhausted every time you go to work, and you just feel like you can't take it anymore. That's the beauty of nursing. There's so many areas that you can work at. You can take a break from that area, switch to another specialty, and see how you like it. Maybe you'll just stay there, or sometimes you just need a break. After a year, you can always go back to that area if that's your preference. Okay, so that will really also help you change specialty, do something that's not gonna cause you so much stress. Time management is also very important. Make sure you organize and plan your time accordingly. Okay, do not procrastinate on charting, because sometimes we feel like we can do it later, and you never know what may happen. Depends on what specialty you're in. You know that things can just go wrong, and then you find yourself all caught up and you're not able to do what you were previously doing. Then this can cause you, you know, so much stress, because you're like, when am I gonna do this, when am I gonna do that? And you know, for nursing, if it's not documented, it's not done. So you want to make sure that you do your chart, your documentation, your patient care as you go on. Manage your time wisely. Okay, and also do not hesitate to ask for help if you feel like you need it, because sometimes if you see someone just sitting down, they don't, you know, seem to be busy, and you're just busy with doing so much at one time, you can, you know, just ask them, do you mind checking on that patient for me, see what they need while you take care of whatever it is that you're taking care of. Or just, you know, not ask them to document for you or ask them to go do a whole, you know, task, but little things here and there that you can, you know, ask for quick help. Someone, you know, might be willing to lend a hand. So don't be, you know, afraid to ask for help if you really feel like you need it. Okay, also consider advancing your career, so you can go to grad school, do something if that's gonna help you switch to a whole different area, become a provider where you can work in clinics, or just a whole different area that will give you a much better schedule, give you more control of your work and your time. Okay, that will give you more flexibility, if I can put it like that. If you're experiencing any of these or going through this situation, you feel like you're exhausted, I hope this video helps give you some of the tips or things that you can do. All right, but if not, consider you know, seeking help. Take care of yourself. Talk to somebody, find a mentor, someone that can guide you through, so that you'll be able to, you work so hard to get to where you are in nursing, and I don't just want you to give up easily. And I hope that you find help, and I hope that you get support from your job, your co-workers, and don't be afraid to reach out. Okay, so I hope this video helps, but thank you so much for watching. And if you like this video, give it a thumbs up, and also subscribe if you haven't already, and hit the notification bell so you don't miss out if I post any new videos. Okay, comment down below, let me know what you think, if you've ever experienced this, or you know, some of the ways that you cope at work. All right, but thank you for watching this video. I appreciate you. Stay blessed. Bye.